The Central African Republic may have successfully held presidential elections 6 months ago, but things have not yet returned to normal. That's according to Doctors Without Borders. They say more than half of the country's population is still in need of humanitarian assistance, while nearly 400,000 remain displaced. We're joined in studio now by Doctors Without Borders spokesperson Bori Lachranji. Bori, good morning and thanks for your time. Give us some idea of what is happening on the ground in the Central African Republic 6 months after those elections.
Yeah, Vicky, thanks for having us. I think it's important to remember that the world took note of what was happening in the Central African Republic in 2013 after a coup and then sporadic violence throughout 2014. The situation has de-escalated, but it certainly doesn't mean that everything's back to normal. The numbers you mentioned are quite concerning. If we just look at the total health needs in that country of 4.9 million people, the health system is, I guess, what you could call sort of a phantom health system. It's largely dysfunctional. It's certainly not working optimally. So what we see is massive health needs of a population, many of whom are still internally displaced because of the violence and the conflict. And as recent as like a month ago, we're still seeing sporadic fighting inside the capital in Bangui, but also in outlying regions like Bambari or Bangassou or Bogila. So the security situation in the country is definitely not stable, and there's still a big requirement for the local population to be protected by international forces, and that's not currently happening.
So break it down for us. What is wrong? I mean, like we say, we had these presidential elections 6 months ago. The new government, is it trying? Is it battling? Is it facing many challenges but trying? Or is it pretty much nothing much has changed?
I think we really do need to look at the total context here. So this is a country that for very many years been subjected to instability. As I said, the health system is not functioning adequately at all. So after the coup in 2013, we knew that upwards of 70% of all medical facilities were either destroyed or damaged during the conflict. To give you a more precise idea, inside the capital Bangui today, there's an area called PK5, a largely Muslim area. And inside this neighborhood, we provide the only 24-hour, 7 days a week medical care at a maternity clinic. Now, last month, what happened is there was fighting between rival armed groups, and this led to 12 people coming into our facility seeking urgent medical treatment. So you can imagine a maternity facility where our midwives are normally trying to help mothers give birth safely. Now, all of a sudden, they need to deal with an influx of men who are wounded, screaming in agony. So 3 of those wounded died in the facility. And this situation continues. If we look at other outlying regions in remote areas where the security situation is wholly inadequate, it's incredibly difficult for patients to make it from where they live to facilities that we run. So we operate 17 projects around the country. And what happens is that many of these roads that people have to pass on, either by motorcycle, taxi, or by foot, are controlled or used by bandits as well to extort money from people who travel along these roads. So people decide that perhaps they'd rather not seek help at all than risk becoming a victim of these armed groups or bandits.
You're doomed either way. I mean, there was a major donor conference in Brussels that happened last week. Are all of these factors, whatever you've just spoken about, is that preventing donors from coming forward? Is it preventing people from coming into the CAR and offering their help and being able to carry out those duties, even if the help is there?
I think it's incredibly hard to work in the CAR, and this is something that brings with it security risks, but it's also something that donors have become they're disengaging largely. And when this happens, there's very little other providers in the way. So to give you an example, our total operating budget working in the Central African Republic last year was in the order of $58 million US. Now, if we compare that to what the Ministry of Health indicates as being its operating budget of $60 million US per year, it's a quite shocking comparison. We're a privately funded medical humanitarian organization. So we're not at the level of big states like the US or the UK in terms of its donor contributions, which over the last year or so have been diminishing. So if we compare that, just to break it down per person, roughly what we're spending is about $11 per person per day per year. Now, if we look at what's currently under discussion, what that donor conference tries to mobilize is roughly $16 per person per day per year. So it's a wholly inadequate situation, and aside from the security situation that doesn't improve, it's also the fact that donors are falling into the trap of believing that there's this normalization or stabilization that's occurring.
So they're not needed as much.
Yes, and that's precisely not the case. So if the Central African Republic were one of our patients in a facility today, maybe out of the emergency room, but it certainly cannot be removed from life support, and it certainly cannot be discharged.
All right, thanks very much for that insight, Borrie Lagrange from Doctors Without Borders, just giving us an idea of what exactly is still happening on the ground in the Central African Republic.